Stress is a normal and daily event that is part of everyone's life. Sometimes stress is good, like when it helps motivate us to get out of bed in the morning, practice a skill, do a good job at work, or strive to achieve a personal goal. But when stress becomes too much, it can become harmful and can lead to both medical problems like hypertension and emotional problems like depression or suicidal thoughts if left unmanaged. Any major change, whether it be positive or negative, has the potential to be stressful. Positive events like getting married, earning a promotion, or buying a house can create stress. Routine daily problems that continue over time, such as bad traffic, arguments with a spouse, or money issues, can also create stress in your life. What you will learn is that it's not so much the event, but how we react to the situation that creates positive or negative consequences. Let's take a look at some examples. Think about the experience of an upcoming job interview. Some may think about it as an intimidating nightmare, while others look at it like an exciting opportunity. Or how about the constant crying of a newborn? Some immediately feel the doom of a huge burden, while others will experience an uplifting sense of the miracle of life. A final example includes when someone is faced with a medical disability, disease, or experiencing chronic pain. There are so many different ways to respond to this situation. Some may give up and believe their lives are essentially over. Others may view the challenge as an opportunity to adapt and find new ways of accessing joy. Again, it's not so much the event itself, but how we react to the situation that creates positive or negative consequences. The way we handle everyday problems can greatly affect how much stress we experience. If we don't deal well with problems that come up and end up reacting impulsively or even aggressively, or end up denying or avoiding the problem completely, or end up hurting ourselves, we may end up with more problems than we started with, not to mention feeling more stressed. The addition of more problems and more stress can negatively affect our physical health, as well as our mental health. On the other hand, if we deal with problems by listening to our feelings, using tools to help us do one thing at a time, picturing our success, and planning for it instead of impulsively reacting to problems, we're likely to feel much less stressed. You might notice feeling better physically, like having more energy or being more relaxed, and also feeling better emotionally, feeling more hopeful and more in control. Problem-solving therapy is a program that teaches veterans a set of skills to better handle stressful problems. It teaches useful and practical steps to planful problem solving that build hope and resilience. These skills are helpful to overcome the challenges of hopelessness, depressive thoughts, negative mood, and pessimistic attitudes. This program can also help you to set reasonable goals, be creative in coming up with good solutions, make better decisions, and know what steps to take when things are not going well. We know that solving problems is difficult when you are burdened with negative thoughts or overwhelmed with uncomfortable emotions. That's why problem-solving therapy will also teach you how to stop and slow down, and then think before you act. This allows you to better understand, learn from, and regulate your emotions before jumping into making action plans. People who have been taught the skills of problem-solving therapy have found them to be very useful and effective, specifically addressing symptoms of depression and hopelessness. This is also one of the treatments of choice for any veteran who has previously engaged in self-harm and would like to learn new and different ways to cope with stress. If you think problem-solving therapy might be a good fit for you, talk with your VA provider. We look forward to working with you.